my name is Wouter Aukema. I'm 59 years old, based in the Netherlands. In my life, I've always analyzed big data. With my company Trust Factory, we analyzed the behavior of computer users for multinationals and large corporations in the world. And since I sold that, I am in the lucky position that I can spend my time on topics that are of interest to the people. And since over 4 years, this is all to do with COVID.
Yes, Wouter, could you explain to us what damning data you have found, or actually the removal of this data, which is, I think, a better descriptive of what's been going on, because it's very alarming, and you've done some brilliant work exposing this essentially data corruption, data manipulation that's been happening in the Netherlands.
Yeah, so since 2021, I have been working with Professor Theo Schetters in the Netherlands and Professor Ronald Meester on the vaccination data and the excess mortality that we saw happening in the Netherlands. We published an article, and based on that, Parliament member Mr. Pieter Omtzigt submitted a motion in Parliament in the Netherlands where he called for an independent academic research into the excess mortality and the possible relation with vaccination, with the COVID vaccinations. Up to today, this motion, which was, by the way, unanimously accepted by the entire Parliament, up to today, this motion has not been executed by the government.
Just want to stop you there, Wouter. The parliamentarian who did this, he was it end of December? Was December 2021 when he?
That is correct.
Yeah,
that is correct. And so I followed the data publications by the Dutch Health Institute. Every week they published the progress of COVID vaccinations in the Netherlands. And so as you can imagine, they were reporting a cumulative number of first doses administered, the full primary series were completed, and the booster doses, etc. So following these data publications every week, you can imagine that you end up with a across the weeks, a cumulative number of doses that were administered. And it was in May 2022 that I discovered an anomaly in the publication of the Dutch Health Institute, and maybe I can illustrate that by sharing my screen, if that's okay, Sonia.
Yes, absolutely. Please go ahead.
Let's see if the technology is working. Yeah, so I will maximize my screen, and basically, let me explain what it is that we're looking at. This is a timeline horizontally from January 1, 2021, all the way up to end of December in 2022. And the graph indicates data points every week where the government, the Dutch Health Institute, reported the number of first doses administered for the target group of all people in the Netherlands. Why am I looking at first doses only? Because then we are sure that we are talking about people. Yeah. When we are looking at a data item, for instance, of primary series completed, you end up in all kinds of fuzzy definitions. With Janssen, you only had 1 dose. Or if you have been tested positive for COVID, you could have 1 Pfizer jab. So I just wanted to get rid of that definition. This is why I'm looking at first doses only. because they represent people. A person can only get a first dosage once.
Yes.
So these are the cumulative numbers. And on 16 May of 22, the Dutch Health Institute reports 13.47 million first doses administered. And then all of a sudden in the data, I see a drop.
Right.
We are going down by surprise to 12.8. So I expected that there must have been some kind of correction. And so what I did is I went to look at the Dutch Health Institute's website. And let me show you what it is that they said. I used Google Translation to provide an English version of the text for the audience. So this is the website of the Dutch Health Institute. And I found a news article of 24th of May 22, where they are saying that the vaccination figures are more up to date due to the optimization of monitoring. And so let me scroll down to what I'm reading here. The COVID vaccination information and monitoring system. This is the vaccination registry of the Dutch government. And we use SIMS, which is the abbreviation for this registry, as the basis for the vaccination figures. Using SIMS makes it possible to no longer include people who have emigrated or died. We no longer use estimates based on vaccines that have been administered. And so this is interesting.
Yes, it is.
To say the least. Yeah. And in the weekly report, which I don't have on my screen here because it's in Dutch, they mentioned that they are no longer providing data for people that have emigrated or died that were in fact vaccinated. So we no longer see those records, and they mentioned in their weekly report that they are going to filter out the people who have emigrated or died every week from now on. And in order to illustrate...
I just want to stop you there about it. Do they give any explanation? Obviously, you're showing me you've done a translation. Are they giving any explanation why they are choosing to do this?
Yes, they do. Very good question. Actually, they mention it here down below. In order to calculate vaccination coverage as a percentage of the target population, it makes sense. It actually does make sense to no longer include the people that have deceased or emigrated. Because if you are talking about a vaccination coverage, then you compute that indicator based on the living population in the Netherlands. So that makes sense from that perspective. What does not make sense is that you delete historical records.
Yes.
Yeah, somebody who died received a vaccination, and it doesn't make sense to just simply delete these historical records. The implications of that are tremendous. So this is what I noticed in the Dutch Health Institute. Now let me show you what I saw in the Dutch data, because I've been following that on a weekly basis. Let me see, where's my article? Here it is. And let me show you a picture where I have analyzed on a weekly basis since May 22, when they so-called optimized the method. I can see that the number of first doses administered is going down. This is a cumulative number. It should not be going down. It can only go down if you delete records.
Yes.
And so the line here shows the total cumulative number of first doses over the week going down. And these are the records that are disappearing on a weekly basis. This includes emigrated people or deceased people. And this is yeah, it is strange. It is the impact of this is huge, because if you would want to analyze let's say the death of 1,000 people in a particular time period, and you want to understand how many of these deceased people have had a vaccination or not, you can imagine that if you start removing these people, that you will find only unvaccinated people. Yeah, and
Yeah.
so any comparison between vaccinated and unvaccinated people is going wrong, is completely wrong. Yeah.
Yes.
Also, you are hindering academic researchers to do any form of analysis that makes any sense. Now, in order to further understand the problem, I went to the European Centre of Disease Control, where we will find on their vaccination dashboard the number of doses. Oh, there we go. I thought I had properly prepared, but apparently it.
And then if you could make it bigger, Wouter, if you could.
Yeah, I most certainly will. One moment, I just need to build it up again. There we go. Now,
so this is the European
yeah.
Centre of Disease Control, their dashboard there.
That is correct, and what they are showing is the vaccine uptake in the population of Europe, and from here we can also put some filters on. So let me show that to you. This is the uptake of the primary course. I only want the first dose.
Yeah.
So I want the number of first doses administered. There we go. And we see a map of Europe. And look here in the Netherlands. It shows only 11.8 million.
Right, yes.
So, and this the latest update for this data, as you can see on the bottom left, is 5 October 2023. Then they stopped reporting. This is rather disturbing, because bear in mind, if I go back, here we are looking on 16th of May. My Dutch government tells me almost 13.5 million doses. Then they went down to 12.8.
Yeah.
And they were weekly deleting records. In the European Centre of Disease Control, oh, let me show the Netherlands, we are now down to 11.8 million, yeah. Even worse.
Yeah, a few million disappeared.
Let me show you the notes on the data, because every EU member state reporting into the ECDC has notes on the data. And when I scroll down, we see country disclaimers down below. I want to show the country disclaimer for the Netherlands. Here it is. It is a big chunk of text.
Yeah.
And it is maybe a little bit small. Let me see if I can increase that a little bit. One moment. Trying my best. There we go. Okay. So this is the country disclaimer for the Netherlands. It is a huge bunch of text. And let me point you to the important part. There we go. NB column. Doses administered to people who are since deceased or have emigrated are not included in the reported doses. And as data from these persons are currently also incorrectly removed from historical vaccine coverage estimates. This leads to an underestimation of the historical vaccine coverage. It will be corrected in the next upload.
So just to stop you there, they're admitting there's been like a mistake, right? That wasn't the intention to do that. It's done, it's incorrect.
Incorrectly,
So,
exactly.
and that they are then going to rectify it. They're going to amend it shortly, right?
Well, this country disclaimer has been here for more than 1.5 years. So
Yes, exactly. So they just
it
didn't do
never got
anything.
corrected.
They'd never corrected it. They said they were
Exactly.
going to, and they didn't. And a whole year and a half has passed. Wow, that's just
Yeah.
really shocking. Um, I just wanted to just step back a little bit because obviously you've written an article you published on X. I think it was in September. Um,
Yes.
and you mentioned, so obviously we have Peter, I'm going to probably pronounce the last name incorrectly, so please correct me.
Omtzigt. Yeah.
Omzicht, um,
Yes.
parliamentary member. So he called for an independent, research, an investigation essentially on excess deaths in the Netherlands.
Yes.
Um,
That is correct.
his motion was unanimously accepted, and
Yes.
the result of that is that the Dutch government weren't they saying they were going to transfer they were going to make accessible for all researchers access to this database, the CIMS database. But you're saying
Yes.
they never made it accessible because in your article you wrote that it was only made available to accredited researchers, not to.
That is correct.
Okay.
That is correct. So, and that is not all, because what they did is, this is December 21. Now, this vaccination register only became available to some accredited institutes in January 2023. So they've stalled the
Oh,
whole
I see.
process for over a year. No, but that
So,
is one. That is one.
right. So
The
yeah,
second thing is, and this is what I discovered, the registry is made available incomplete because people who died or emigrated are not in the database.
yes.
So it is impossible to do proper research on that data. This has been confirmed by a report, an article from Professor Ronald Meester and Dr. Mark Jacobs in the Netherlands, where they have clearly acknowledged my findings. Yeah, it's the data that the government provides is unworkable. It is dirty, it is corrupt, it is incomplete.
The data that has been made accessible to everyone is unusable.
Correct.
Right.
That is correct.
And obviously it has been systematically, they've deleted thousands of weekly, thousands of records. And this started from the 16th of May 2022. That's when you saw that drop.
Yes, which is just a couple of months after the unanimously accepted motion by Parliament member Peter Omtzigt.
Yes.
So, and then there was this whole fuzz about privacy. You know, we cannot share this data because of privacy and blah 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 blah. It took more than a year for the registry to become available in this corrupted form through the Dutch Statistics Bureau. They used some weird route to make that available.
Because
And
in your article, you mentioned they transferred the data from the CIMS to this Dutch Statistics Bureau. And we are saying,
yes,
we are assuming that's when they did the deletion. That's when the deletion, do you think, happened? When they
yes,
started to remove it, was during that transfer, undercover.
yes. So exactly. So what I suspect is that the Dutch Health Institute is not actively deleting records. They are just not providing them to the Dutch
Statistics.
Bureau of Statistics
I get it.
and the ECDC.
And the EC,
They
yeah.
are also not getting it, as we saw in the country disclaimer for the Netherlands. We incorrectly deleted the records.
Has the Dutch Statistics Bureau obviously, responded, made any sort of like acknowledgement of this removal, and what have they said?
Well, there is this employee of the Bureau of Statistics, and he's on Twitter. Obviously, he mentioned that I was lying and it's not true, and the Bureau of Statistics never deletes records. And
Wow.
Well, of course they don't.
Outright denying it.
Yes, correct.
How can
correct.
they explain then the decline in the cumulative number of first doses, which you can clearly see? How can they deny?
They're not. Of course, they don't react to what I observed, because then they would admit that the database is corrupt. But I used a trick. I socially engineered my way into the contact center of the Bureau of Statistics. And maybe, well, I can probably say it. What I did is I was very sad on the phone to a young student of that contact center, and I explained that I would be in a lot of trouble unless they would give me one number. I need one number. How many first doses does the Bureau of Statistics have in this registry?
Yeah.
And they published it. So now, from the Central Bureau of Statistics, I have an official confirmation of the first doses, of the number of first doses that are in the registry. And maybe I can show that again. Yes. Sorry if it becomes a bit messy, but I think it is important to show the audience. So based on my social engineering, the Dutch Bureau of Statistics published on March 14 of this year, and I'm sorry, it's in Dutch only, the number of people in the CIMS data set as per January 2024.
Mm.
And this is a spreadsheet, so I will download the spreadsheet and then I'll open it up to see what is inside the spreadsheet. Here's the spreadsheet, and the number of vaccination doses that they have, the first known vaccination, 12,594,932.
Right.
So let me hover over to a calculation that I made.
And that's as of January 2024, that number?
That is correct.
Right.
That is correct. So let me recap, and I'm sorry that the slide is in Dutch, but these are vaccinated people disappearing from that SIMS registry. The Dutch Health Institute gave a weekly update on the vaccination data.
Yeah.
This is the date. These are the number of first doses. And on 16 May, as I showed, we saw 13,472,817.
Yeah.
On 23 of May, they reported 12,884,602, so that's a reduction of 588,000. On 5 September, they only mentioned 12,850, which is another reduction. Then, if we look at the Central Bureau of Statistics, where they made that registry available, on 20 November 23, they only had 12.66 million in there. And as I showed, based on my social engineering, they published the total number of first doses for January 24, which is 12,594,932. So altogether,
yes,
I am missing 878,000 first doses. These are people.
Yes, could you make that slide a bit bigger so people can clearly see that? Could you just enlarge? Yes, because this is a really important slide, because you're clearly seeing the removal, the drop in that number is critical. Yeah.
Yes, so the sources are down below. to the data sets and to the Central Bureau of Statistics. So everything is based on official government data sources. Now, in validating this, I did a cross check. And the way I did that was to go to the Bureau of Statistics, where I downloaded the number of people deceased or emigrated. Yeah, total number deceased or emigrated in the same time frame that I was looking at.
Yeah.
So in total, we have over 1 million people who died or emigrated, and the Health Institute reported a vaccination coverage of 82.8%, and coincidentally, I get to the exact same 78,000 people. So this is again a clear confirmation that these people are gone.
Yes. These historical records have just been deleted. Yeah.
So how can we do research into
Yes.
the large amount of excess death in the Netherlands in relation to vaccination? It is professionally sabotaged, Sonja. I have no other word for it.
Yes, that's the best way of describing it. It is clear sabotage, and it's and I mean, also they admitted, their excuse was, this is a mistake, we need to correct it, and they never did as well.
Exactly. And in this process of transferring vaccination records from the Dutch Health Institute towards the Bureau of Statistics, they came up with a data protection impact assessment document. Yeah?
So this is, just to clarify, this is the excuse they gave why they need to do this, because it's data protection.
Yes, exactly. Okay, so this is the literal translation of that data protection impact assessment. Now, the CBS, which is the Dutch Bureau of Statistics vaccination file, covers in principle the data of all persons who are part of the CIMS dataset. However, there are a number of categories of vaccinated people who are not included in the Dutch statistic vaccination file. They are filtered out of the CIMS dataset and therefore not included in studies. These are people whose social security number has not been verified, people with only a healthcare number, people who have no vaccinations registered, and people who have died or moved abroad. It literally says so in the data protection impact assessment. Now, when I published about this, questions were raised by Dutch Parliament members to the responsible minister. And the minister responded that, they made a small mistake in the data protection impact assessment, and we will correct it. Yes, of course, nobody is removed from the data.
Yeah.
That is how the minister responded. Well, the document never got corrected.
Yes.
The dead people are not back in the registry. I have a clear confirmation of that by the Health Institute and by the Bureau of Statistics. So it's still not there. It's still not fixed.
Exactly, and they've clearly specified who've been removed and people who have died,
yes.
or you've just highlighted red. So how can it be a mistake where this is what they've done? They've clearly black and white have said this is what they've done.
It's by design. It's by design that makes it so bad. Yeah. And so what I did.
It's so deliberate, isn't it? It really is.
It is deliberate. So that makes it data fraud, Sonja. I have no other word for it.
Yes, yes.
Now, and to add to the story,
I wanted to ask what has been the response? This MP who Pieter Omzicht who brought up. So obviously he must be aware of what's happened. Has he been in touch with you? Have you been, have you reached out to him? Any sort of update on?
He is on sick leave for a couple of months now.
I see. Okay. And you
Unfortunately.
discovered this, you noticed this back in May 2022, right? When you started.
Well, I discovered it last year in 23.
In 23, right.
Yeah, so I've been working on that. Obviously, there are Parliament members, of course, that are very well aware of what I discovered, but they are such a minority in Parliament that nobody's
Right.
the mainstream news is not taking any serious effort on that.
Yes.
To add to the corruption, to add to that, I need to show a passage from this data protection impact assessment, which leads to my belief that they are using a double ledger in the government.
Yes, you mentioned this in your article. Yes, please explain what this double ledger is.
I want the audience to understand why I say this, and so for that purpose, I'm showing again a literal translation of this section. So this is the data protection impact assessment. The source to the machine translated impact assessment is here in my Google Drive. So here's what they say. After pseudonymization of the vaccination data, the data will be made available for A, implementation of statistical research by the Statistics Netherlands Bureau, and B, for the execution of scientific research in the remote access environment of Statistics Netherlands. And then they explain what can be done with the data set mentioned under heading A. And you can see a whole list of detailed analysis capabilities that are possible for version A of that SIMS registry. For version B of the SIMS registry, they say the following. Additionally, the vaccination data is made available under strict conditions. And after you pay a lot of money, it costs you 20,000 euros to gain access.
Wow.
To the Bureau of Statistics for scientific research based on Article 41 of the CBS. Yeah? The remote access environment is a tool, blah, blah. Researchers who have access to vaccination data can conduct analysis as long as they fall within the purpose of the research project. And who defines what research projects are allowed on this registry?
Yes.
The Dutch government. The Dutch government.
Mm.
So when Professor Ronald Meester submitted a research proposal together with Dr. Mark Jacobs, the government refused access to the vaccination registry. Isn't that interesting?
Yeah, so just to clarify, essentially there's two versions of the registry, version A, version B.
Well, that is what I read from this document. Now, maybe I could be wrong, but this is when they specify two sections where the data will be made available. One for the statistical research by employees of the Statistics Bureau, and another data set for the execution of research in remote access. Yeah? So to me, that says I have an internal registry and I have a remote access registry, external. Now, with regards to the internal version, they specify a whole detailed analysis capability to which outsiders have no access, only CBS employees. And then secondly, they say, well, if you want to do research in that remote environment, you can do so as long as it falls within the purpose of the research project. What it reads in terms of the research questions that may be addressed with regards to the internal version of that registry. Causes of death, Is there an association between COVID and causes of death? What is the association between hospitalization and causes of death?
Yes.
Groups of causes of death. What has been the impact of COVID epidemic on life expectancy? What are the causes of death? Comorbidities of deceased individuals. Yeah. What is the vaccination status a mediator in the association between socioeconomic status and premature death? What are the determinants of long COVID? Longitudinal tracking of vaccinated versus unvaccinated individuals, ideally corrected as much as possible for immunity. Hospitalization admissions, etc., etc. They are sabotaging any academic independent research into what is going on with the health of the people, and
Unless you're
they
a
are
government,
sabotaging
yes.
any root cause analysis. They do so intentionally. This is not by accident. This is by design.
Yes. I mean, this really is, they are, the fact that only if you're a government employee, you work with the Statistics Bureau, you have access to all the data where you can actually make any meaningful assessment, any meaningful analysis.
I think it is a crime that they are hiding data for us so that we cannot find the truth.
Well, yes, they're hiding the truth, aren't they? Yes.
Yes, and that is a crime in itself because it is by design.
Yes.
And it is systematically.
Yes.
And I don't see it only with the vaccination registry. I also see it with the adverse events being reported with regards to the COVID jabs. Remember the previous talk that we did, where
could you just do a little quick recap, because you based on your amazing analysis, your software tool, essentially, you were able to download over the past 20 years, over 6,000 medicinal products from which database was this? This is Eudravigilance, right?
Which correct? It's just the pharmacovigilance database of the European Medicines Agency, and they too are trying to hide the data from us. I explained in our session that it takes you hours to download the data for the case safety report for one form of medication. It will take you more than a life to download it for 6,000. Yes. So I hacked them in a legal way, together with Tron van der Poel, brilliant software developer, a friend of mine here in Holland. We came up with a little Python script so that now we can download 15 million case safety reports for all medication within 2 hours of time.
Yeah, amazing work you and your team have done, yeah. Really.
And what is disturbing, Sonja, is that if you repeat download all that data, then I can investigate how many records were added every week, and I can investigate how many got lost or ended up missing, got deleted. 40% of serious case safety reports end up missing.
Wow.
40%.
40%. This is, yes, from the Eudravigilance pharmacovigilance database. From what time period, Wouter? From
with the investigation that we did together with a friend of mine in The Hague, covers October 21 for 52 weeks, all the way up to November 22 for the COVID jabs.
October only. 2021 through to November 2022, they have removed 40% of the case safety reports reported to Eudravigilance to do with the COVID vaccines, right?
Yes, that's correct.
Just the
COVID. For the COVID vaccine, serious case safety reports.
That is,
So we're talking deaths, we're talking hospitalizations, we're talking disabilities, you name it. Yes.
and this is for Europe in general, or just for the Netherlands? What states are, or is it hard to determine from which country?
This is worldwide.
Worldwide. Wow.
I know Eudravigilance contains also the US.
Yes.
It contains all the countries. Yes.
Ah, that is just, I mean, I'm shocked, but then I'm not shocked at the same time. It's sort of a weird um it's awful. It's really awful. They're so blatantly, you know, yeah, just removing data, removing any sort of any safety signal. They're hiding it, removing it, deleting it, making it hard for people to download. Obviously, unless you have your expertise, no one else would be able to do this.
Yes.
But that 40% is shocking. Have you written about that as well? Was that in your
We
article?
have I have a forensic report, 140 pages forensic report is ready.
Oh,
We are waiting. We are waiting for the proper momentum and opportunity to publish it.
yes. No, I thank you for sharing that with me and the audience, because this is a huge, this is massive. It really is. 40% worldwide have just
Yes.
gone,
Yes.
case safety reports. And it's all for all the related COVID vaccines, Pfizer, Moderna, all of them.
Yes. Yes.
And are you able to share the slide where it kind of visually shows how it's a drop? Is there a way of, if you can't, that's
I did not prepare for that. I can give it a try. Give me one moment, please. Hmm.
Can you mention again, just to go over how you discovered the 40% of the total case reports being removed, 40%? Was it as you were downloading the data? How did you make that discovery again?
Because we downloaded the case safety reports inside Eudravigilance every week for all COVID vaccines.
Right, okay.
And in my systems, I analyze these, and there we go. I'm almost there. One moment, please.
Because last time we spoke, I believe it was in May of this year, you hadn't discovered that, right? This is a new finding.
That is correct. So let me make sure that I need to get rid of some sensitive mails, please. One moment.
Oh, yes, please. Yes, go ahead.
All right. Okay. I will share my screen.
Yes. So just to recap, so Wouter, what you're going to be sharing with the audience, you're going to be sharing how we're going to see basically evidence of this crime of 40% of case reports worldwide reported for the COVID vaccines have been systematically removed from the period of October 2021 through to November 2022.
Yes. So I will show part of the report. What we are looking at here, and let me see if I can increase that just a little bit. There we go. The visualization here is showing a timeline from 1st of January up to November 22. We are looking at case safety reports mentioning fatal events. So these people died.
Wow.
I split them up in AstraZeneca, Janssen, Moderna, and Pfizer. If you go to the PSAR, the Public Safety Update Report of Pfizer, you will find that Pfizer reports 8,322 fatalities.
Yes, because I've been analyzing the PSCWAs. Yes, this is the fatality. So this is what they're saying is their total. This is the cumulative number.
Exactly.
For
now, because we download it every week, I am with the team, we include the fatal reports that ended up missing. And then we get to 10,193.
So when the blue line, which says team, is you and your partner doing this,
yes.
You know, this is your number, your cumulative number each week, right?
Yes.
Wow, you see that huge discrepancy there, huge drop between.
Yeah. And this is just one example. Let me zoom out and see if I can. It's been a while since I've looked at it. We are providing evidence for deletions. Like I said, 40% of serious case safety reports. We are seeing modification of case safety reports, retroactive modification.
Wow.
After the data lock point. This is unheard of. Yeah, it is very difficult to show. But here is a case safety report form for AstraZeneca that we downloaded in 22 July 2022. We can see it is from the non-European economic area, so it's outside Europe. It was submitted by a healthcare professional, and the case is serious. We see an age group of 18 to 64. Okay? If we download that very same report 2 months later, the age group has disappeared.
Yes.
What does that do with safety signal analysis?
Yes, you would just.
It is no longer included in that cohort.
Makes it invalid, right? It makes it redundant.
Exactly. So the report is gone.
So shocking. It really is.
And it is if you it is very technical stuff. But I can show you that for other forms of medications, we checked for another medication called Synagis. There we do not see so many deletions. You see so there we don't see the same behavior of record modifications and retroactive removals as we see with the COVID jab. So that is what makes it even more disturbing. There seems to be a preference within the COVID vaccines. There seems to be a preference for deleting.
A cover-up, what is essentially going on.
Yes, flattening the curves. Flattening the curves, that's what they do. Yeah. Okay, so I just wanted to give an example of record removal, record modifications, and so in terms of the data integrity inside the Eudravigilance, we're looking at material integrity issues, and you cannot claim that these products are safe because 40% of the records have been removed. It is ridiculous.
And this is just across the board, purely for the COVID vaccines. You just showed, obviously, you zoomed in on the number. This is just for Pfizer, with that drop of about almost 2,000 reports removing, and obviously you're including now
Fatal report.
Those are the fatal reports. Yes, yes. And this is the serious case, but serious case safety reports include hospitalization and death as well, don't they? It's combined.
Death, life-threatening situations, hospitalizations, disabilities, and congenital anomalies.
It's just, I mean, thank you so much for sharing. This is obviously, you've shown me extracts of your paper that is to be published. When will you be publishing your paper?
Yeah, like I said, we are waiting. Well, it is a report. It is a forensic report, and we are waiting for the proper momentum to an opportunity to submit it, because these are hard times, Sonia. Normally, back in the old days, we would submit a report to the auditor of the EMA, right? And we would trust that they would follow up on it properly.
Yes.
What can we do today?
Yes.
Who can we trust?
Exactly. Yes. I mean, the very institutions that people have trusted in the past it's just been obliterated, right? The trust of these. I mean, going back just lastly to these case safety, these are reported by medical professionals, right?
And by patients.
And by patients to this institution, to Eudravigilance, right? That have just been wiped out 40%. It's just.
Yes. And I'm not saying EMA is doing it. I don't know who is responsible, because there's a whole chain in the process of pharmacovigilance. It starts with a doctor or a patient filing a case safety report at their national competent authority. In Holland, it is called the LAREP. In Germany, it's called the Paul Ehrlich Institute. And so every EU member state has their own competent authority, if you will.
Yes.
And in the US, but also probably elsewhere, you can also file case safety reports towards the marketing authorization holder. Yeah, so the pharmaceutical companies, who also have a legal obligation to forward these reports into EMA. Now, where in the process these deletions are taking place, I cannot see. With one exception. If a market authorization holder wishes to remove a case safety report from EMA, they have to submit a so-called nullification request.
Okay.
Where they explain why they want the record deleted and et cetera, et cetera. So they have to justify any deletion. I have all nullification requests of the EMA.
Wow.
And it doesn't match with the deletions that I see.
Right.
When I reported on that, EMA stopped publishing the nullification requests.
Yes. Right. So what
that source is now gone.
Yes. What did you see? Because you said there was a discrepancy between what was the nullification requests, the number, and what you've seen actually being deleted.
More than 50%.
Wow.
So twice the amount, if not more. More than twice the amount of the nullifications. I see records disappear.
Yes, so you see more records disappearing than the actual nullification request. It doesn't add up. It's not matching. It's okay. Yeah. Well, that shows that they have, I mean, it's just.
And where this is taking place, I don't know. EMA says that it's not true what I'm saying. They are not deleting records. Okay, fine.
Well,
but somebody else must be doing it, right?
Yes. Well, yes. I mean, from what you have just said, you can easily infer, easily imply that it has to be coming from within EMA that they're doing this.
Now let's take a look at the annual report of, and I don't have that at hand here, but I will tell you by heart. the annual report of the European Medicines Agency towards the European Commission. Try and dig those up. If later on I can send you links to these documents. Annual report. EMA is reporting to the European Commission end 2023 that they have 24 million case data reports.
Okay.
How come I can only download 15 million?
Sorry, you can only download 15 million, 15.
Yes, not 24.
Wow.
Where's the rest? Where is it?
Been deleted, been removed. It's
it's not being shared. That's a fact. Nobody can download it.
Yes.
No doctors, no scientists, nobody.
I mean, Wouter, you really are a hero in doing this. And I use that word, you know, like for the full meaning of that, because you have uncovered so much here. And there's so much evidence, because numbers don't lie, you know, that there's so much, they carry so much weight. And the fact that you have uncovered this pattern that has been going on for a very long time. And so I just really thank you for doing that. Thank you for
thank you for your huge compliment, and I am worried, Sonia. I'm worried because how on earth are we going to put sufficient pressure on these organizations to be transparent and open? How? Who can do that?
you name and shame.
We don't.
You have to name them and shame them, maybe. I don't know. I mean, I think if enough people know what is going on, they'll be, yeah, they need to answer for what they've done.
Yeah.
Right? They really do, you know. But thank you so much for your time, Wouter. If there's anything else you wanted to add before we end, please do so.
Thank you very much for giving me the opportunity to share my work with your audience, Sonia. I appreciate it very much.